The early signs for me was there was change in my bowel habits. I also noticed I was getting much weaker when I would climb a flight of stairs. I started to bruise more often, and I lost 20 pounds in a month, so I knew I had to do something. My name is Elaine Griffin, and I was treated for colorectal cancer at the Cancer Center at Robert Wood Johnson University Hospital in Hamilton. I had a colonoscopy, and they were not able to complete it because there was a 95% obstruction. Which was causing the pain that I had, and because they weren't able to complete the colonoscopy, I was referred over to a CT scan to confirm the size of the tumor. I knew in the beginning of April that I had cancer. I was several months shy of my 45th birthday. I spent my 45th birthday in chemo treatment that week, and I will tell you, the doctor had said if I had waited and done things as prescribed, I would not have seen my 45th birthday.
Elaine did have a CT scan prior to her surgical resection, which did not show any metastasis. She was appropriately referred to a surgeon and successfully had a resection.
I had a colorectal surgery where they removed my bottom part of my sigmoid colon as well as part of my rectum.
We had a discussion regarding the benefits of chemotherapy in her stage cancer, and as she was young, the decision was to proceed with chemotherapy, which she completed in 3 months.
When I was diagnosed, I was told that my spring and my summer were going to be really tough. But I was told if I listened to what the doctors told me to do, my fall and winter would be amazing. And I'm living proof that everything is amazing. And so I think my zest for life is definitely something I'm willing to kind of focus on. Very grateful that I'm still here. Every day I just have to lead with, purpose and intention. I think that that's the most important thing.
She was a young patient. It was a shock for her to have a diagnosis of colon cancer this young, but she had a very positive attitude.
The only thing you can do in an abnormal time is have normalcy. And for me, I've dedicated most of my life to my career and my family, and those things had to stay constant for me. I had a lot to fight for, and I didn't want to miss out on any time. When you have cancer, there's a lot of unknown, but when you can trust your team, that's what you need to be able to focus on, and you know that they've got the right skills, they've got the right training, and they're going to weigh the options for you.
It used to be colonoscopic screenings were recommended at the age of 50, but we lately have seen cases of colon cancer occurring in younger patients, the age group from 40 to 50. Thus, there is a change in screening guidelines which recommends screening as early as 45.
When I was in the hospital and praying to God for my life, I actually made a deal with God, making sure other people knew the importance of colonoscopies. And since my diagnosis, I've taken to not only social media, but to in personal conversations with people, the importance of getting colonoscopies. To date, we have over 1,400 people that have completed their colonoscopies since my journey. So I am making it a point to make it more common for people to talk about the importance of this life-saving test.